a fair and just economic recovery is something that's extremely important, and that involves a green recovery, that involves a feminist recovery, and that involves an economic recovery that looks at the varying needs of municipalities across the country, from urban to suburban to rural, also looking at northern issues as well, which is very distinct in terms of some of the policy challenges that it face, including housing, including labor, including childcare, etc. In addition to some of that work, it's also really important when looking at municipal policy, how do we ensure that we're incorporating good urban planning policies? Thinking about the sort of cities that we're looking to create, who are we building cities for, but also who are we building cities in terms of how can we keep the people that also currently live there. Across the country, there are many individuals who are facing the possibility of having to leave their city because they can no longer afford it. And if we look at cities like Toronto, this includes racialized folks, this includes folks who have lower to no incomes, who are currently living in a city that is increasingly becoming unaffordable. So cities are pushing out existing populations to, one, accommodate those with higher incomes, but also building a city around a particular demographic. So when we're thinking about who we're building cities for, we also have to think about who are we building cities to help retain those who currently work there and live there and have long lineages there. We want to ensure that we can help and support those individuals maintain the places in which they live.
The nonprofit sector is a highly feminized workforce. In Ontario, we have about 1.5 million or around 1.5 million nonprofit workers, and 80% of these workers are women. We provide essential services in housing, in shelter, in childcare. And what the pandemic has clearly exposed for the broader public, at least, is how undervalued and underpaid many folks in essential services are. So the nonprofit sector as a whole is very much underpaid compared to even the public or private sectors. And this is very much an issue of decent work for women and the systemic undervaluing of women's labor in our society and the systemic undervaluing of care work, right? And so if we're trying to build a feminist city or a feminist economy, whatever that means, we absolutely have to consider the value of the care economy, of the nonprofit sector, of childcare workers, of those who take care of our children and our elderly, and reconfigure some of how we currently operate, because there is a lot of inequity and exploitation.
With every generation since World War II, there has been an increased focus on the mental health needs of people because it became more generalized to the larger population. I think having, multiple ongoing social pressures like poverty, lack of housing, precarious education and employment histories and opportunities certainly create larger mental health pressures that have been present for since Western society was created here in Canada and have grown exponentially. I think there's a moment in the general Canadian consciousness that mental health is important. Is society changing things to provide that mental health support to Indigenous women? Not really. In fact, I would say the need is even greater, because if we actually just take a little step back and look at what the mental health service and status was for Indigenous people in general and Indigenous women in particular, mental health service was already under-accessed and under-accessed and not actually available for Indigenous women before the pandemic even started. And now it's at an even larger crisis rate because of the pandemic has put that strain on the workforce. So for instance, I was trying to call somebody this morning to get an Indigenous mobile mental health team out to a family. Well, they're just not running right now because of the pandemic. So what has to happen? Somebody calls 911 and the cops go there along with the ambulance to an Indigenous home where there's a young Indigenous woman who's suicidal. Like it's this, nothing's actually really being addressed systemically or in service. And I think this traces back to what my original point really was, that there are huge gaps in how feminism does not actually address Indigenous women's problems, and by excluding Indigenous women from the solutions and the frameworks that society is putting forward based in feminism, which, you said at the very beginning, Maddie, is about bringing that equality.